Hi, I'm Mark Garofoli, and today we're going to be reviewing MTM, Paying the Bills Without Pills. In essence, today we'll be reviewing not only the basics of MTM and the background of MTM, but most importantly, how to actually get paid to do what we want to do as pharmacists. As far as a little bit of a background for myself, in the past I've spent about a decade in community pharmacy, and most recently, in the last 4 years, I've been with Humana Healthcare as a clinical pharmacist, primarily performing MTM services. As far as a professional background, I received my PharmD from the University of Pittsburgh School of Pharmacy, my MBA from Strayer University, and a couple certifications including the Certified Geriatric Pharmacist, the APHA Immunizations, the APHA MTM, and also, ironically enough, a certification in weapons of mass destruction. As far as personally, I live in Morgantown, West Virginia with my beautiful wife Gretchen Garofoli, who also happens to be a pharmacist and also presents with freeCE.com as well. Today's learning objectives include the ability to describe medication therapy management, or MTM, history, also to explain various MTM settings, implementation, and ways to actually be paid for MTM services, and also to describe MTM references, certifications, and other networking capabilities. To start out here today, what I'd like to go over is a more of a bigger picture idea. Until we have a broadcast sitcom or a YouTube video show, we really need to do our best describing what we do as pharmacists. I certainly challenge anyone and everyone to take up the idea of thinking about how you would describe our job as pharmacists to the general public in 15 seconds, sometimes also known as an elevator speech. The way I like to look at things is, before we get into MTM, let's think about what we do as pharmacists in general. Thinking about the elevator speech, if the President of the United States walked on an elevator with you and asked you what you do as a pharmacist, realistically, what would you say when you only have 15 seconds of his time? In order to get to where we are today in regards to MTM Pharmacy, I'd like to take a brief moment to go over a couple of the bigger concepts of the history of pharmacy. As far as worldwide, the first pharmacy was actually in the year 754 in Baghdad. Approximately 500 years later, Emperor Frederick II legally separated physicians and apothecaries. And only 1 year later, there was the first pharmacy in Europe, which is still operating today in Germany. Now let's come over here to America. The first pharmacy in America can still be actually walked into and viewed today. It's in New Orleans, and it's known as the New Orleans Pharmacy Museum. It's on Chartres Street, and also you can see here that there is a web page for that. It's not exactly the biggest attraction in New Orleans near Bourbon Street, but still has to be close to our hearts for anyone ever visiting the area, and I certainly encourage anyone to visit there. Now let's jump up to modern pharmacy today. We have many different aspects of pharmacy today as our profession as a whole, including residencies, technology, specializations, immunizations, as I mentioned earlier for myself, weapons of mass destruction or WMD training, many other certifications, and also MTM. The overall idea is that currently we are branching off into many different venues within our profession, which is important to do. However, that also takes us away from growing our main trunk, or the core of pharmacy in general, which is why I included on this slide a picture of a tree with many branches. Now, as far as the future of pharmacy, I am a pharmacist, not a psychic, so I certainly cannot predict the future. But just as the Farmer's Almanac attempts to do, we can certainly attempt to gauge where we can grow our profession at the core, the main trunk of our profession in this tree example, and not just branching out. Speaking of the future of pharmacy, what in the world is MTM? Let's take our pharmacist caps off for a moment and think of figuring out what MTM is in the eyes of the layperson. First off, we could do a Google image search. This picture of this Audi car is apparently an Audi MTM. That is what a layperson could find immediately on the internet. Going a little bit further into a more interesting reference is on Urban Dictionary, the production company that produced the Mary Tyler Moore Show is what comes up when searching MTM. Another reference, very popular, is Wikipedia. More so hits the nail on the head. Medication Therapy Management, or MTM, is a distinct service or group of services that optimizes drug therapy with the intent of improved therapeutic outcomes for individual patients. And this actually is referenced directly from APHA. So what actually makes MTM different from what we already do as pharmacists? Here is a very big generalization of what stereotypically tends to happen. On the left, you'll notice the pharmacist happens to be sitting down and reviewing medications with a patient. Stereotypically, sitting down happens to be associated with MTM, whereas on the right, you'll notice the pharmacist standing up, going through an aisle, and counseling the patient on one point for one medication. Let's explore a little bit further the difference between MTM and patient counseling for a couple of examples. The first example is to explain adverse effects of individual prescriptions. As one can see and agree, this is patient counseling. It's for individual prescriptions for one moment in time. The next example is to document a patient encounter. Documentation happens to be a very big part of MTM. Thus, this is certainly part of MTM. The next example is to actually follow up after the patient encounter. This is also another integral part of MTM, so clearly is going to be an example of MTM Pharmacy. The next example is to review a patient chart in a long-term care facility. Although this is getting close to MTM, it is still bordering on patient counseling. The next example is to simply update a medication list. This again is just patient counseling. Okay, now that we've covered what the concept of MTM is, let's address where these services actually occur. A key idea to remember is that any healthcare professional can provide MTM services. However, one could also argue that it is most logical for a pharmacist to do so because of the extensive medication knowledge. Here I present different settings that MTM will typically occur on a daily basis all across our country. The two main portions are face-to-face or telephonic. For face-to-face, certainly these services will occur in pharmacies, doctor's offices, and other not as traditional but happening every day types of settings. One thing I would like to mention on the telephonic portion is that pharmacists will typically work in call centers or even working at home. One thing to keep in mind on the telephonic portion is that an average pharmacist will realize that they may be able to be anywhere to perform the MTM services, but the patient could also be anywhere. I've literally seen examples of patients being, as you'll see towards the left, in a fast food restaurant, or, as you'll see in the middle, in a fishing boat during a review of their medications. Or, even on the right, you'll notice a small picture of a casino. It has happened where patients have literally been at slot machines and had their medications reviewed thanks to the wonderful use of technology today. Albeit comical at times, it can still be a very effective way to reach patients who would not have been reached otherwise. One of the main ideals of any MTM service is to emphasize patient empowerment so that our patients can learn how to deal with medication issues in the future and know how and when to ask the best questions. This idea is very similar to the old saying, you can give a person a fish and that person will eat for one day, or you can teach him or her to fish and he or she will eat forever. Another key aspect that MTM brings to the table is the patient care triangle. The patient care triangle reminds us that MTM interactions are not one or two-way, but among many healthcare providers and most importantly our patients. Now let's take a moment to review the core elements of MTM services. That is to say, what the actual service includes. As you'll see here, the MTM core elements include the medication therapy review, or the MTR, which could be either the complete medication review, which is known as a CMR, or a targeted medication review, known as a TMR, and also included is the personal medication record, which is also known as PMR, and also the medication-related action plan, otherwise known as the MAP. And certainly also included as a core element would be the referral and/or doctor contact, along with, very importantly, the documentation. First, I'd like to go over the medication therapy review, which could either be the CMR or the TMR. When completing an MTM service, there's basically two main concepts of what will be done: either a targeted single item or a complete review of everything. One can think of this as being similar to a visit to a grocery store. You can either be going to the store for your entire grocery order, kind of like a CMR, or for just one item, like a TMR. However, either way you might be enticed to grab something else, whether getting something not on your original master grocery list, or by deciding to just get everything you need when originally walking in the store for just one item. Through this different point of view, I wanted to make it evident that although MTM services are either CMRs or TMRs, one can very easily lead to the other. The next core element is the personal medication record, or PMR. The personal medication record is similar to the wallet cards and medication list takeaways from what we used to know as brown bag events of the past. This, however, is a term that I like to call the patient's souvenir. This is what they actually can take away on paper from their MTM service as a souvenir, as I would call it. This picture is actually a portion of the Medicare mandated form to be used universally in MTM services today. The next MTM core element is the Medication-Related Action Plan, otherwise simply known as the MAP. The Medication-Related Action Plan, or MAP, is what I term the patient's homework. This is what they're going to take away and have a little to-do list of what they need to do after their medication review. This picture is another actual portion of the Medicare mandated form to be used universally in MTM services today. The next MTM core element is referral and/or MD contact. Thinking back to the patient care triangle, any referrals extend the triangle to any other healthcare professionals whom could help your patients further. In addition to referrals, as far as prescriber contact, there are complete courses on motivational interviewing and SMART goals. Thus, we will not be attempting to cover those today, but I do highly recommend for your own future learning. The next MTM core element is documentation. One of my favorite quotes ever is from Mark Twain. Sorry I would have made this letter shorter, but I simply ran out of time. I present this quote because there can possibly never be enough documentation. One would argue there could be too much, but a general rule is document and then document more. Let's be frank, documenting on paper or electronically is very cumbersome, and not many actually enjoy doing so. That being said, though, it is essential, not just for MTM, but we'll concentrate on why for MTM today. Being that most people in general do not enjoy documentation, let's review two scenarios that highlight the positive sides of documentation. First off, being frank once again, pharmacists are quite frankly not cheap to employ. However, we know we're more than worth it. Documentation in return on investment, or ROI, studies can actually help prove that. Those types of studies are revolutionary and can really help to prove our worth as pharmacists. Also, we as healthcare professionals work best in teams. However, for a moment, let's think like a legal professional. Could any of you imagine a scenario where you recommended life-saving medication, which you documented, and the recommendation was declined, only to later find out that your patient died of the exact scenario that you were looking to prevent? Now let's take a moment to go through the typical flow of an MTM encounter, including the introduction, going over patient background information, reviewing the patient medication list, doing the actual medication review, and then of course documentation and setting of follow-ups. First, let's review going over the introduction and really setting the patient goals and expectations. The purpose of going through the introduction of an MTM review is to really gauge the patient's health literacy and how in-depth your conversation will go. One really wants to gauge the actual expectations of the patient to gauge where you're going to go with the medication review. Next is, of course, the patient background information and gathering of all the patient pertinent information. Upon a patient's first encounter, the process of gathering the patient health and history may be a very laborious step, but very crucial, and also will be easier going forward once the information is gathered and documented. I certainly encourage everyone to always go over all medical conditions, asking about a patient's medication allergies, any past surgeries and procedures, and certainly any family and social background that would be pertinent. Next up on our MTM intervention to-do list would be gathering the patient's medication list. Although one can view gathering the patient's medication list as a very simple process, there are a couple things to keep in mind. This is similar to the brown bag volunteer events of the past that many pharmacists and pharmacy students participated in. This is meant to be an interactive part of the medication review. I strongly encourage everyone to not only read through a patient's medication directions and uses, and simply the names, including brand and generic, of all medications, but also using ideas like the readback method, or having the patient simply read back or state back what you've reviewed for each medicine to really make sure that you have the most correct information. And always include prescription, over-the-counter, vitamins, supplements, herbals, and anything else that the patient could think of that they have been using. Now it's time to have pharmacists shine. Next up on our to-do list within a typical MTM intervention is the medication review. The actual review of medications is certainly the pharmacist's strongest point. This is where we as pharmacists will be searching for interactions, the timing of dosages, past immunizations, medication adherence, and the list goes on. One thing to keep in mind is that the review of these medications can be completed while in discussion of the medication list or after compiling a complete medication list. Really, that will go towards whatever each pharmacist is most comfortable doing. The next and final step within a typical MTM intervention is documentation and setting of follow-ups. I know that we've already gone over documentation in the past, but a couple take-home points on the idea overall is once again that the patient is going to be walking away with their quote-unquote souvenir or their personal medication record, and also their quote-unquote homework, which is their MAP, their medication-related action plan. Those are some of the most core components in regards to documentation for MTM services. At this point, you also want to set a follow-up with a patient. One of the huge distinguishing factors of MTM compared to regular consultation is that we actually will follow up with the patient to ensure the best outcomes. In addition to that, we will also be contacting providers if necessary and setting follow-up time with their offices as well. To truly understand the payment system for MTM services, let's briefly review the history of some legislation surrounding MTM services. Back in the 1960s, some long-term care centers initiated medication reviews, which, as we mentioned earlier, isn't necessarily an MTM service. However, it was certainly getting closer to expanding the use of the knowledge and skills of pharmacists at the time and going forward. Fast forward all the way to the 1990s, that's when Hepler and Strand defined pharmaceutical care. Here is a picture of Linda Strand. I honestly could not find a picture of Dr. Hepler. However, going forward to 2003, that's when the Medicare Modernization Act, or MMA, started. The purpose of MMA was that the Center for Medicare and Medicaid Services, otherwise known as CMS, required MTM services to be included in Medicare Part D plans starting in the year 2006, which would be 3 years later, but gave time for a lot of planning to start for where we would go with providing MTM services. This really paved the road for where we are today. After the Medicare Modernization Act of 2003 started MTM being required in 2006, the first 6 years of MTM following, there were very basic changes year to year involving what patients to target for MTM services based on the number of chronic diseases and conditions and or the number of drugs that a patient was taking and or the drug spending for each individual patient. However, the bottom line of these initial 6 years was that mailings, just simply sending a paper mailing to patients, sufficed, since patients actually had to opt in to the MTM services. The next big event in the history of MTM was the Affordable Care Act, or ACA, which made changes to Part D once again. As of 2013, Medicare Part D MTM services were required by law to include an annual CMR, which could be furnished person to person or using telehealth technologies. That includes a review of the individual's medications, also a written or printed summary of the results of the review, and follow-up interventions as warranted. So let's go over the Affordable Care Act in a nutshell. Once again, this happening in 2013. At that point, MTM services were no longer allowed to merely consist of mailings, and now must be face-to-face or telephonic. This is a huge win for us pharmacists as healthcare professionals. Also, targeted patients are automatically enrolled and can opt out, which is exactly opposite of how it was in the past. Before, we basically had to convince patients that MTM services may benefit them. Now, patients are automatically enrolled and we can get more into the actual MTM services themselves and still certainly explain the value of those services to our patients. In essence, the way I like to look at this is that the upgrade of consultation instead of mailing is similar to the fundamental law that a pharmacist must physically be present in a dispensing pharmacy building in order to operate, and not just a phone call away. This difference of now having to be face-to-face or telephonic and not just simply a mailing is that much of a difference for MTM services as that law would be for the opening of a dispensing pharmacy. As I mentioned, for the previous 6 years between 2006 and 2012, targeted patient requirements changed yet again, but for the better. Now there is a maximum of 3 chronic diseases required as of 2014. That is to say that a given Medicare Part D plan could not require a patient to have a dozen chronic diseases to qualify for MTM services. That's maxed out at 3 chronic diseases being required. Also, there's a maximum of 8 prescription drug plan, or PDP, drugs required. That is to say that a given Medicare Part D plan could not require a patient to be on something like 2 dozen medications to qualify for MTM services. That is maxed out at 8 PDP drugs. Also, expected drug spending has to be at least or greater than $3,017. As far as the 2014 Medicare MTM service requirements, they include interventions for both beneficiaries and prescribers, also annual CMRs with written summaries in CMS's standardized format, which, by the way, those standardized formats are what we reviewed earlier for the PMR and the MAP. Also, quarterly targeted medication reviews, or TMRs, with follow-up as necessary. So in essence, as of 2014, CMRs and TMRs are required. By now, many of you are probably thinking that since patients can switch plans every year, what actually financially drives a Medicare Part D plan to want to help improve a patient's overall health? I welcome to the table the concept of star ratings. Medicare Part C and D star ratings are one of the newest and most important ideas when it comes to understanding our healthcare system as a whole. A major financial driver for medication plans to help their patient achieve better overall health, other than the obvious things, are star ratings. Medicare Part C and D plans receive plan ratings on a 1 to 5 star rating based on safety and quality for 53 different performance measures. So each of the 53 measures are rated 1 to 5 stars. In addition, each measure of the 53 performance measures has a weight ranging from 1 to 3, and many of these performance measures are pharmacy driven, including medication adherence, influenza vaccines, high-risk medication use in the elderly, or HRME, and also suggested therapy, that is, diabetic patient on an ACE or an ARB medication as a suggestion overall. In the big picture, plans receive financial bonuses for attaining higher star ratings, and beneficiaries, or our patients, can enroll in 5-star plans at any time during the year. The concept of these Medicare star ratings is definitely something that is newer, but is very important to understand, not only for us as healthcare professionals, but also for our patients to know and be aware of, at least, going forward, to truly understand our healthcare system as a whole. The reason I mention these very important star ratings is that essentially the ratings explain why any Medicare plan will pay for MTM services that will eventually increase their respective star ratings. As I mentioned, plans receive financial bonuses for attaining higher star ratings. This is literally what is paving the path for these plans to pay for the MTM services to be completed. Financial bonuses could range from thousands of dollars to hundreds of thousands of dollars, thus explaining why many plans will pay for MTM services to be provided. If you would like more information on star ratings, please visit www.cms.gov. Okay, now that we've gone over a brief background of MTM, let's get to what I like to call show me the money. The MTM question of the day, question of the week, question of the year. It's on everyone's tongue. How can I realistically do this and get paid and fill prescriptions and administer flu shots and consult patients and? The ands go on forever. The time does not. However, I enthusiastically would say to everyone, just do it. If you think about our past as pharmacists, sooner or later, along the way, everyone just had to do it. Okay, so now with the realization that when it comes to MTM, we have to just hit the ground running and just do it. So where do we actually begin for getting paid to do these services? Currently, there's 3 big picture payment options. There's, of course, cash payments. Within taking simple cash payments, there's the tricky part of finding patients and or family who are willing to pay for these services. Secondly, there's certainly the Medicare billing, which is directly billing, whether through paper or electronically, directly to Medicare, which involves Pharmacist MTM coding. Third, there's MTM vendors. The MTM vendors, or what I like to call middleman, work on patient selection for you and taking care of the theoretical billing for you as well. Here is what I've compiled as a relative comparison of the 3 payment options, which are on the left vertical column, based on 4 evaluation concepts, which are on the top horizontal row. As you can see in going through here, I've basically ranked, without using numbers, what's the highest or lowest risk, the easiest to execute, the toughest or easiest ways to go through the process of billing or actually being paid, and then also the potential for financial gain. In going through this, one can see that cash payments are best for financial gain potential because there's the most risk. That is, starting off one's own business or even working through typically a current pharmacy or really finding a niche. But within just working on cash paying customers, there is naturally more of a risk, but because of that, the financial gain has a higher potential. At the same time, MTM vendors are typically the easiest to actually process through MTM services. In addition to figuring out what type of payment process or option you would like to go with eventually between cash payments, Medicare billing, and MTM vendors, also in the big picture, one would have to think about what type of MTM business option he or she would like to go with. In general, there's the MTM startup business, which typically will have the primary payments of cash and or Medicare billing. On the other side of the coin, there's MTM within a current working pharmacy. The primary payments there include certainly Medicare billing and or the MTM vendors, which enter the picture with a use of a current pharmacy within the MTM business option. Out of the two big picture MTM business options, let's first review the MTM startup business. The first thing that should come to anyone's mind for a startup business would be, of course, the startup funding, whether access through personal wealth, a bank, or even a venture capitalist, also known as a shark or angel investor. That's one of the first things to think about, certainly when starting a business, is the capital or finances to pave the way for that business. On the other side of the coin, on the idea of the decision of payments, one also has to think about taking cash payments and or Medicare billing. One of the core elements for any type of startup business, let it be MTM or any other type of startup business, is to have a business plan, really regardless of where the startup funding is coming from. I say that because the business plan is an essential roadmap for business success. It'll generally project 3 to 5 years ahead. Now here today in reviewing MTM, we are certainly not going to go into the intricacies of a business plan. If you would like more information, you can certainly go to the U.S. Small Business Administration or our own even APHA MTM business site, as both are listed here. However, for a brief overview, I would like to at least show you a business plan. A typical business plan will be many, many pages. I've attempted to show that type of document in one page here, so this is a very brief overview. I would say this is a general overview of a business plan, more so for your reference if needed in the future, but the main components of any business plan include an executive summary, a SWOT analysis, determining the operational needs and or changes, how you're going to market your service, how you're going to bill for your service, how you're going to implement your service, and then anything else needed in the appendix. And once again, we're not going to go into that here because there are other big picture MTM payment options and business models, which we'll get into shortly here as well. One thing I would like to mention, because it is just that important, is regardless of the MTM business model that you choose, whether a startup business or in a current pharmacy, if you bill a Medicare plan for MTM services, you cannot provide MTM services free of charge or at a reduced rate for other patients. This is considered Medicare fraud. Now I'd like to touch base a little bit on Medicare billing for MTM services. Currently there are current procedural terminology or CPT codes. These are an accepted means for documenting medical services. They generally need to be accompanied by an International Classification of Diseases, or ICD code. As far as CPT codes go, there have been many revisions, and the most current will be the 10th revision as of October 1st, 2014. CPT codes are basically what are used to bill for a healthcare service through Medicare, whether it be an immunization, a hospital stay, or, as we're discussing here today, an MTM service. Currently, there are 3, yes, only 3 MTM Pharmacist CPT codes, which, by the way, are the only Pharmacist CPT codes. The first, 99605, is basically to document an initial encounter of MTM service performed face-to-face with a patient in a time increment of up to 15 minutes. The second, just simply adding one digit, 99606, is a subsequent or follow-up encounter with the same patient in a time increment of up to 15 minutes. The third and final code, another increment of 1, 99607, is an add-on code for additional increments of 15 minutes for use with either of the preceding codes. So although we have 3 codes, it's really just 2 different types and 1 add-on. The main idea to take away from this brief review of the CPT codes relevant to pharmacists is that even though there are only 3 codes, as you can see, the paperwork, whether actual paper or electronic, surrounding the mere 3 codes is much, much more. Furthermore, as pharmacists strive for provider status state by state and nationally, we can only then expect to have many more of these codes. Alright, well, to put it bluntly, got that? By now you're wondering, what if I want to help my patients with MTM services and not attain a degree in medical billing? And as I mentioned, as pharmacists strive to attain provider status, this billing may get even more complicated, aka more codes. Well, thankfully, MTM vendors have actually come to the rescue on these points. First off, I would like to give 3 examples of some of the more common MTM software vendors. Here I have listed their contact phone numbers, their contact email addresses, and also where each one is centrally located, because if one is ever thinking about a job within each company, they would certainly want to think about where the company is located, not only for professional licensing, but also for personal life. First off, there's Outcomes, with the information provided here. Secondly, there's Marixa, with information provided as well. And lastly, I have mentioned PharmMD, with information provided as well. These are certainly not the only MTM software vendors, and I would also think that there will be more new MTM software vendors coming in the future. These are just 3 examples of some of the most commonly used MTM software vendors currently. If you want to start providing MTM services as soon as absolutely possible in a current pharmacy, this is the slide for you. There are a couple of things that you want to know about MTM vendors before picking up the phone or sending an email. First, MTM vendors are contracted with Medicare insurance plans. Also, MTM vendors point out which of your current patients are MTM eligible from the contracted insurance plans. Also, MTM vendors directly pay pharmacies for MTM work. For example, contracted rates for specific MTM services. On the first point, MTM vendors are contracted with Medicare plans to begin with, not with patients or pharmacies necessarily, but with actual Medicare plans, which goes back to our earlier idea of the STARS measures and ratings as one of the drivers for paving the way for MTM payments. On the second point, I would like to emphasize that MTM vendors are not going to be providing you with new patients Yet the vendors will be pointing out which of your current patients are MTM eligible and participating with a Medicare plan contracted with that particular vendor. Another key point to keep in mind is that different vendors are contracted with different Medicare plans. Thus, as long as it is okay with each vendor at the time, a given pharmacy could utilize multiple MTM vendors to find more MTM-eligible current patients. This is another reason why we reviewed multiple MTM vendors. The third point is that in essence, MTM vendors do not necessarily do the Medicare billing for your pharmacy. The vendors more so eliminate the need for Medicare billing because of the contracted rates for specific MTM services. One can never discuss the contracted rates for MTM services in regards to what specific amounts are, but everyone should know that actual payments to MTM providers varies among the different services such as complete medication reviews and targeted medication reviews. For example, there will be a specified rate for addressing a patient's adherence and a different specified rate for doing a CMR. This is a great time to think back to the grocery store example that I reviewed earlier, in that any one patient can end up having multiple MTM claims and payments to a given pharmacy based on needing multiple MTM services. In essence, there is a domino effect to being paid as a healthcare professional for providing MTM services. Okay, we've reviewed a lot of information in regards to MTM and a lot of background ideas. But as far as actually implementing your MTM services, there's a couple of big picture ideas to wrap up and put everything all together. First and foremost, I would ask, when do you want to start your MTM services? If your answer is soon, then one could think about MTM as a business. Going back to the idea of being paid via cash-paying customers versus Medicare billing. If your answer to the original question is that you'd like to start tomorrow or as soon as possible, then your setting is going to be in a pharmacy via the MTM vendors. And to do so, you would simply want to reference the contact information that I provided earlier for some of the example MTM vendors, and simply call or email and set up with each of the vendors. Next up on the plate is deciding what you're actually going to be doing within your MTM services. In essence, what MTM services would you like to provide? Would you like to go into actual complete medication reviews or CMRs? Or would you like to go into targeted medication reviews? For instance, would you like to address adherence for many of your patients? Would you like to go over immunizations? Would you like to go over the timing of doses? Or, in the big picture, would you like to do both? Going back to that grocery store idea or example, kind of ping-ponging between CMRs and TMRs. Something that's very common because naturally they will help each other. In addition to that, you could also consider reaching out to a specific population, whether a geriatric population, going into specifics like an adverse drug event prevention, keeping in mind the baby boomers. The reason I mentioned a generation in particular is that one thing that we'd want to consider is that going back to the cash paying idea, one would really have to find the perfect niche or group of patients who would actually be willing to pay for these services when most people still don't necessarily know what this MTM is all about. Hopefully we're addressing these concerns as a profession as pharmacists, but we still do need to get the word out to our general population. I would encourage everyone to also keep in mind that a journey of thousands of miles begins with one single step. In all honesty, it is not that huge of an endeavor to start low and go slow. And what I mean by that, other than a typical little rhyme for dosing, is to start low volume-wise. In essence, maybe just reach out with MTM services to 1 or 2 patients a day, and then go slow, gradually increasing the volume of the MTM services over time. It wouldn't necessarily be realistic to say that you would be performing 2 or 3 dozen complete medication reviews a day within your first week. One does have to be realistic, and that goes back to if starting up your own business, having a business plan, or even if working through MTM vendors, really reaching out to those patients, your current patients, who have the biggest needs up front. I recently had a pharmacist ask me if it were reasonable to try and complete 1 CMR over the course of a given workday and then increase from there. My simple answer was, you hit the nail on the head. Start low, go slow. But either way, you have to start somewhere. Not to take the copyright from any companies like Nike, but eventually as a profession, like many other successful endeavors, we have to just do it and go out there and perform these MTM services. Now, before, during, and after providing MTM services, I would like to review some of the pertinent MTM resources available for you. First off is through our National Professional Organization, or umbrella organization, of the American Pharmacist Association, or APHA, which has an MTM Central website, a very good place to start for some information. In addition to that specific resource, whenever providing MTM services, one of the things to keep in mind is to keep up to date with the current clinical guidelines for treatment of many chronic disease states. These can be found on the website provided for clinical guidelines. One of the things that I had recommended to me once in the past has proven to be very beneficial, and that is to simply sign up for the table of contents weekly emails from the journals or publications of your choice. For example, JAMA or JAFA, and so on. But instead of getting an entire journal or magazine, you'll simply get the table of contents and can choose what you think is most pertinent to review to keep your MTM services up to date. Something also that I've actually personally gone through is the American Pharmacist Association MTM, or Medication Therapy Management, Certificate Program. It is approximately an 8-hour program, give or take, but basically going through an entire day of some of the key points that we've reviewed here in a much shorter amount of time. So certainly with it taking 8 times as long, there's going to be a lot more information. So hopefully I've sparked some interest here today for you in MTM services, and I would certainly recommend seeking out more information from APHA regarding their certificate program. On top of that, something that sometimes we take for granted is some of those associations and all the information they have available to provide, whether APHA, whether your state board of pharmacy, or your state pharmacy association. Either way, all of these have much information that is out there and available. And of course, like we're here today, www.freece.com. Wonderful place to start and continue to get more information. In the end, to summarize MTM, paying the bills without pills, I'd like to go over just the general concept of MTM in general. We've gone over a lot of information here today, but in essence, medication therapy management, it's everything that you've been trained to do, but now doing so in an organized and documented manner. It truly is the present and future of our profession of pharmacy. It's going beyond branching out off of the tree and really growing the trunk of our tree, otherwise known as the profession of pharmacy. At the end of any given day or week, one has an obligation to him or herself to be able to say that he or she enjoyed what has been accomplished. MTM just may be able to provide that for you, and it is my hope that we've covered many different ideas and ways of actually being paid for these services here today.